I'd want to thank Reverend Sam for the opportunity to serve and to pioneer the department many years ago. Reverend Sam, I'd known Reverend Sam since 1998 now. He comes to our university of Lagos while I was in medical school to preach in our fellowship, so I'd followed him from there. So when I got back to Abuja many years after, and I saw him, I guess I was working in National Hospital, so I saw him on the television, and then I went to meet him in his church. Then the church was at Owena House. That was how it all began. I was the only doctor in the church, and so people come for medical things. So I decided to set up the medical unit just at the back of the church, and that was how it all started. So for many years, in and out, we have been able to help quite a lot of lives. And we thank God for many of the people who God have used along the line. Then I started inviting my friends to church who are doctors, Dr. Jegede Babatunde, Dr. Michael Olubile, Dr. Maxwell, and so many people started coming one after the other to join the church so that they can provide support in the medical department.
It's been a wonderful experience from the inception, from the moments where we had to source drugs from little quantities from our different suppliers. Myself and my sub-team, we had to make lots of sacrifices in terms of getting medications, not just medications, but effective and cost-effective medications across to the clinic. My name is Lillian Onyechi Opalako, and I'm a pharmacist and servant leader at the pharmacy sub-team of the TTC Medical League.
Good afternoon, church. Good afternoon, everyone. My name is Teresa, Mommy Twins in TTC. This Annabelle, this Mirabelle. I want to say thank you, church. I want to say thank you. I appreciate all you people have done in my life with these children. Reverend Sam Oye, may God bless you. Since the day you pray for my children, all those days, if I use that name, my children will heal.
My name is Pastor John Olisa, and I'm here to thank the Medical League of the Transforming Church. It's been about a year since the incident occurred. My son here was sick, and we thought it was general teething. But in about 24 hours, he had vomited like 20 times. God helping us, we came to church. The professionalism with which we were treated was mind-blowing. About 5 doctors instantly attended to him. But I'm particularly grateful to the medical department for intervening. We're also giving financial support. We are so grateful to the medical team. You literally saved his life, like literally saved his life.
Hello everybody, my name is Adesu Akinriola. I'm a member of the Transforming Church, married to Mr. Jibola Akinriola. Of late, we've been beneficiaries to the Medical League, even during pregnancies, and a whole lot. And one thing that stands out for us is the quick response that we get whenever we call on the doctors, nurses, pharmacists. We get drugs, we get medications, we get consultations, and we just want to say a big thank you to Reverend Dr. Sam Oye and Pastor Mrs. Mary Oye. It's a big thank you to the Medical League.
So my name is Oluwaseun Stevenson, mom to Abiola.
And my name is Abiola Lily Stevenson.
So about 8 years ago, she just came back from school and started complaining about this headache. We thought it was a regular thing.
The migraines have been really stressful and kind of traumatic.
We used things, it didn't work. We changed medications, it didn't work. Until we got to the medicals, TTC. It was very intensive. We thought it was just going to be a touch and go thing. She ended up seeing 3 doctors. The dedication, the attention.
We finally got a diagnosis, and he suggested that I take some pills and I go get my eyes checked. I got my eyes checked the next day, and ever since that day, with the drugs and everything, I've not had headaches. The headaches used to be like every day, and I don't go a day without having headaches. But throughout the entire day, I didn't feel anything. I felt relieved. I felt peace for like the first time in 8 years, and that is kind of like a miracle for me. And I'm really thankful to the medical team for helping me.
I remember we were having the TLOP Sport Fest, and there was one game that we played involving strong physicality. I didn't know that I was taking on more than myself that day. It was a very strange day. After the game, I realized that I couldn't breathe properly. I just went to calm myself down somewhere. Almost losing consciousness, my head was spinning. And I just thank God that my wife was somewhere nearby. I just asked her to just quickly help me call someone. And she just went to call Dr. Babatunde. And that was how they came, just quickly rushed me to the clinic. Only God knows what magic they did. Probably they passed an injection. Probably it was some fluid. I don't know. I just realized that within 10 minutes, the strength I was losing, the strength that was fading away just returned back. And it was that day that I realized the importance of the medical team that we had. So I just really want to say thank you. It's a day I can never forget. I want to say thank you to the medical team for the intervention that came that day. God bless you for all you're doing.
Hey, hello everyone. My name is Raji Success. I want to share my awesome experience with the medical team. Medical team, TTC Gwarimpa has been very awesome. I want to say thank you for your service to God and to humanity. My first encounter with the team was 2024 when I was going through some health challenge. So I came to the team. I met with Dr. Babatunde. That was my first time meeting him. But Dr. Babatunde has been so amazing. He has been playing a major role in my life. And I want to say thank you, sir. From the test results and everything, what the doctor diagnosed was I was going through endometriosis, hormonal imbalance, and also a psychological issue due to what happened in my first pregnancy. During the birth of our first baby, we lost the child and everything. So after that first experience, I started having different health challenges, different infections, hormonal imbalance, endometriosis, and everything, psychological issues. So the doctors request that I need to see a mental health doctor who will monitor me and also counsel me in some certain area so that I can feel better, because the symptom that was going on, I was experiencing then, need psychological attention. So I met with Dr. Babatunde. I explained to him. He was so concerned and he connected me to Dr. Henry in the team. And so what amazed me so much about this team is how every one of them are so concerned, they don't take it like they are not paying us. They don't take things casually. They don't see it as it's just church work. They are not going to pay. They pay so much attention to everyone's situation. However, we change the hospital where some of our medical teams are working so that they can be able to monitor the process during your delivery and everything. And also they need to recommend a gynae doctor, gynecology that will follow you up. I was like, wow, that was how he connected me with Dr. Legbe. Dr. Legbe, my wonderful big sister. Thank you so much, ma. Thank you for everything. So he connected me with Dr. Legbe. I met with her during the delivery of my baby. Dr. Legbe was in the theater with me. Everything went smoothly. I want to say thank you.
I've spent like 5 to 6 years in the TTC Medical League. I'm currently the Medical Laboratory Science Sub-Team Lead. And over the years, we've been able to reach out to people as steward of faith through the FEED strategy that includes fellowship, empowerment, evangelism, and discipleship. And this has also affected my own life personally, because from that little experiences, I've been able to connect science and faith.
Hello, my name is Fumbi Aladesomi. I am a psychologist and the head of the psychosocial care unit at the Medical League. I joined the TTC family about 3 years ago, and since then I've provided support to over 30 individuals in the body of Christ. One of the things we see mostly is that there's a lot of stigma around mental health, especially in the Christian community, and that's because a lot of people think that your faith should be enough. But one of the things Scripture says, especially in Isaiah 61 verse 1, is that God has not just only called us to preach the gospel, He has also called us to bind up the brokenhearted. And there are a lot of people that are are brokenhearted in the body of Christ. A lot of people that have had some level of childhood trauma, that are dealing with anxieties, disappointments, grief and loss, and that is one of the things that we address in our department.
My name is Justina Okafor. 2 weeks ago, I came to TTC clinic with my son. So my son was having high fever. I myself is having ulcer. So when they checked my son, after checking my son, they gave me drugs, and after they checked me, they gave me drugs. So I just came to thank the TTC Church for the free drugs, and now me and my son is getting better. Thank you.
This church, we are happy because even you don't have anything, this church, everything they will do for person. They will feed everything for the medicine, everything they will take care, they will take looking person well. We are happy. God bless this church and pastor and my all children.
Hi, my name is Ajane Aduku, and recently I needed medical attention, and I was rushed to the hospital. And when I got to the hospital that I was rushed to is supposed to be, one of the standard hospitals in Nigeria, but they were confused. I was confused. Everybody were just confused because they didn't know what was going on. And then the medical league of the church, they were contacted, and immediately they showed up for me. So my own testimony is the hospital, the church clinic came to me in the hospital, and immediately the league leader, that is Dr. Babatunde, immediately he came. Less than 5 minutes, he knew what was wrong with me, and he moved me from that facility, and then the church started taking care of me. And you can see right now, I am fine, totally healed, totally well. And I think one of the most important things for me is not just the free treatment, it was also the constant follow-up. In fact, Dr. Babatunde at some point wanted to choke me with treatment. He kept on insisting, you have to check this, you have to do this, you have to do that, you have to take your medication, this is what you're supposed to do, you have to check this, and he was so accessible. Every Sunday I come to church, I still go there for follow-up, for checkup. Every help that I needed, the church provided, and it was totally free. It was absolutely free. In this economy, I cannot trade it for anything in the world. So this is me just here saying thank you to the TTC Medical League. Thank you to the league leader, that is Pastor Dr. Babatunde. And most importantly, thank you to the lead pastor of the Transforming Church, because without, this vision, I'm sure I would have been in the hospital right now where everybody would still be confused because they did not know what was wrong with me. So I'm glad I am fine.
Hi, I'm Segun Aladesomi. I'm a medical doctor with the Medical League of the Transforming Church. So I joined the Medical League about 3 years ago, and ever since I joined, it's been very impactful. The Medical League reached out to a wide array of people, and since joining, a lot of patients have benefited. We attend to emergencies, we attend to normal daily medical emergencies, and also we have some follow-ups with patients regularly, and we've been able to impact a lot of lives. And I myself have been a beneficiary of the Medical League. I would like to say, since joining the Medical League, it has helped me in terms of experience and building a sense of community.
Hi everyone, my name is Erime Sioja. I'm a healthcare management and administration professional, and I serve in the HMA subunit in the TTC Medical League. I joined the Medical League about 3 to 4 years ago, and when I came in, at the very first image I attended, we noticed there was no proper structure in place, and this is something that I brought to the notice of the league leadership. And I was given the opportunity to join the subunit and improve the structure and systems in the Medical League department. So far, it's been an amazing few years of joining them, as I have improved even professionally in the clinics that I have managed so far. Spiritually, joining the Medical League has shown me that we can have a community, even in a professional medical department. I look forward to seeing the clinic set up fully, and I also look forward to us reaching out to several people in different communities and just being very impactful, just as our mission is at the Transforming Church.
Hi, my name is Stella Okuna. I am a nurse and I serve with the Medical League. My experience with the medical department has been impactful. I'm so grateful and so privileged to have a platform as this to just give out to the community, to help people. And it's been very impactful, I have to say. And I really just thank God and the leadership of the church for providing such a platform as this to be able to, just help people. We've helped a number of people, and I just want to thank God for such an opportunity as this from the church. So thank you so much.
Hi, I am Andy Shoga. I'm a medical doctor and a public health practitioner and a member of the Transforming Church Medical League. I serve as the lead for the Central Coordinating Desk, and what we do basically is to interact with the church as well as other organizations in terms of planning for outreaches and medical covers. So I think this is another opportunity for the church to reach out beyond looking at the spiritual growth of individuals. I see this as being concerned for the health aspect of their members and the surrounding community. So last year alone, we were able to have 7 activities. Some of them were outreaches, happened in Ushafa. We also had a health cover here in church during the couple's anniversary as well. This year alone, we've been able to have 4 activities. We supported 2 of the TSOM capstone projects, and then we had an outreach at the Kuba branch, and we had an outreach again. It was an external outreach. So basically what we do extends beyond the church.
Hi everyone, my name is Adewale Babatunde. I am a medical doctor, a family physician, and I am privileged to be the head of department of the medical department of the Transforming Church, and also the chair of the Medical League of the Transforming Church. Serving in the Medical League has been a great privilege, and I must say, and we're grateful to the leadership of the church for being concerned about the overall well-being of members of the Transforming Church. I cannot talk enough about the number of interventions we've been able to have also in the clinic of the Transforming Church. I don't know how to tell you the wide array of medical professionals that we have, from doctors or in different specialties. We're blessed with pediatricians, we're blessed with other general practitioners, and we have people in just different areas. We're blessed with people in the eye care specialty. We're blessed with a team of optometrists. We have a team that attends to physical therapy, from our doctor who is into chiropractic, and also physiotherapists and other allied professionals. We're grateful to have our team of pharmacists, our team of nurses, and our medical lab professionals. And how can I forget our mental health and psychosocial support team? We're grateful for the number of people that have been blessed and that have been helped through this outfit of the medical team of the Transforming Church. We're grateful for the support that the church gives, and we're grateful for the lives that have been touched. And this is not limited to members of the Transforming Church. Many times we have people come in from neighboring communities, and it's clear that the main reason they came to church is to be able to get the medical help. And of course, that speaks to the theme of the Transforming Church. And I think about the fact that the church has also invested in having a clinic structure, which we're trusting God to be able to complete the furnishing and equipping. We're grateful for the investment of the church in putting this together. We hope to be able to provide far more services than what we currently do. We hope to be able to set up a fully furnished pharmacy, to continue to be able to provide mental health and psychosocial support for those who are in need. We have a lot of people in need of physical therapy through our physical therapy team, and we hope to be able to do more of that. And of course, to set up a standard laboratory services to be able to make proper diagnosis. Our nurses will be situated. We have our consulting rooms here. Dental services are part of the things we hope to be able to produce through our dental team. And of course, providing quality eye care through our eye care team. This vision can be completed through the generous donation of supporters and people who would want to see us be able to reach out to the community at large. The account details have been provided below, and please consider making a donation today. Currently, the estimate of being able to complete our furnishing and equipping would go at nothing less than 120 million naira. We know that God will lay it on the hearts of some of you watching right now to make your contributions to make this a reality. You will be contributing to saving many lives and providing quality medical services to those who need it. Let's work together and make this a reality. Thank you, and God bless you. And I believe that we will be able to do so much more by the time we settle in here. And we look forward to being able to continue to be a blessing to the community. As Reverend Sam would always say, that real ministry is that makes impact on the community where it is. Thank you, and God bless.